welcome to the Deep Dive. Today, we're exploring something really significant, the connection between meditation and mental health, specifically for those dealing with mental illness. It's a complex topic, lots of questions around it. So our aim today is to, unpack it using some expert insights.
Yeah, and it's crucial we approach this carefully. There's a lot of, let's say, assumptions out there, so having a solid, expert-based perspective is key.
Definitely. And you just have to look at the recent situation in Malaysia to see why this conversation is needed. The 2023 National Health and Morbidity Survey results, they're pretty eye-opening.
They really are. A doubling of mental health issues since 2019 across adults and kids. It's quite stark.
It is. Adult depression jumped from 2.3% to 4.6%. That's about 1 million people.
1 million. And for children, 5 to 15 years old, it went from roughly 8% up to 16.5%.
So like 1 in 6 kids.
1 in 6. That's significant.
And it continues into the teen years. The 2022 Adolescent Health Survey found over a quarter of 13 to 17-year-olds meeting depression criteria, girls higher than boys.
And the figures for suicidal thoughts and attempts are deeply concerning, too. It just highlights how urgent the need is for, effective support strategies.
Right. And that naturally leads people to explore different things, including meditation, maybe looking for some relief.
Exactly. Which is why we're focusing today on the work of Dr. Phang Cheng Kar, a consultant psychiatrist and mindfulness-based therapist.
He wrote this article, Should a Person with Mental Illness Meditate? Updated just this year, July 2024. So still very relevant.
Absolutely. It offers a really balanced perspective.
So our mission for this deep dive is to pull out the key guidelines from his work, specifically for anyone with a mental illness thinking about or already meditating.
It's a great resource.
Yeah.
Dr. Phang really bridges clinical understanding with mindfulness expertise.
Okay, so let's start with that big question he tackles right away. Should someone with a mental illness meditate? Probably the first thing people wonder.
It really is.
Yeah.
And he makes a point straight off that mental health struggles can affect anyone, even people really involved in spiritual practices. He even mentions this common thought, I want to meditate, but I'm not crazy.
Right, sort of normalizing the conversation.
Exactly. And then he clarifies what mental illness actually covers. It's a broad term.
Yeah. What's his definition?
Well, he describes it as a range of psychological conditions affecting thinking, feeling, behavior, enough to significantly disrupt daily life. That includes spiritual practice and meditation itself.
Okay.
And he breaks it down into sort of 2 main categories. Psychotic disorders, like schizophrenia, maybe with hallucinations or paranoia, and neurotic disorders, like depression or anxiety, where you see more sadness, worry, sleep problems, that kind of thing.
Got it. And why might people with these conditions turn to meditation? He touches on that too, right?
He does. He acknowledges that, sometimes professional mental health services aren't easy to access. So people might look for other things like meditation.
A community-based approach, maybe?
Potentially, yeah. But he immediately flags the risks, like having the wrong attitude or unrealistic expectations or just not understanding how meditation might interact with their specific condition.
That's where the guidelines come in then.
Precisely. They provide that essential framework.
Okay, guideline number 1. Seek help from mental health professionals. Seems fundamental.
Absolutely paramount. Dr. Phang is very clear. Meditation should complement professional treatment, not replace it.
Especially for psychotic disorders.
Yes, especially then, as those often need medication and very specialized care. But it applies broadly because, some meditation practices, if you're not careful, could actually worsen things like dissociation or intrusive thoughts for some people.
I see.
So meditating without professional guidance when you're acutely unstable, say, having suicidal thoughts or feeling extremely agitated that's genuinely dangerous, you need that professional safety net.
Okay, that makes total sense. Complement, don't replace.
Yeah.
Which leads neatly into guideline 2, continue psychiatric medications.
Yes, another really firm point from Dr. Phang. Don't just stop your meds because you started meditating.
Right.
Talk to your doctor first, always. Generally, taking meds while meditating is fine. But he also advises letting your meditation teacher or program organizer know you're on medication.
Why is that?
Well, some meds might have side effects, like drowsiness, that could affect your practice. So it's good for everyone involved to be aware. Open communication is key with your doctor and your teacher.
Okay. And guideline 3 kind of flips that communication coin. Inform mental health providers about meditation plans.
Exactly. It's about keeping everyone in the loop. Tell your psychiatrist or therapist you're thinking about meditating or that you've started.
And what if your therapist isn't, familiar with meditation?
Dr. Phang suggests maybe seeking a second opinion, perhaps from a professional who does understand Buddhist practices or mindfulness if you feel you need that perspective. It's about building that full circle of informed support.
Makes sense. Guideline 4 is about community. Join a supervised group.
Yeah, he really highlights the benefits of practicing with others and a qualified teacher. It can be reassuring, less isolating. He advises starting slowly. Don't just jump into an intensive, silent retreat right away, especially without close supervision.
So maybe look for classes focused on mindfulness in everyday life.
That's what he suggests, yes. Those tend to be more grounded and perhaps less overwhelming initially.
Okay. Guideline 5 is very practical. Prioritize basic needs in retreats.
Yeah, this is crucial, especially on retreat. Things like getting enough sleep, food, water, rest. He mentions there have been cases where people's mental health worsened on retreat due to sleep deprivation or intense fasting.
Wow, yeah.
And critically, if you find the meditation itself is increasing your stress, you need to pause, reassess, and definitely talk to the teacher about it. Don't just push through if it feels wrong.
Right, listen to your body and mind. Guideline 6. Discuss new or unusual experiences. What's that about?
This is particularly relevant for people who might have experienced psychosis. Dr. Phang points out it can sometimes be tricky to tell the difference between, say, a genuine spiritual insight and a psychotic symptom, like hearing voices.
Ah, okay, so distinguishing between the two.
Yes. And the key is open communication. Again, talking about these experiences with both your meditation teacher and your mental health professional to get clarity.
Got it. Now, what about people who find sitting still really hard? Guideline 7. Adapt meditation for restlessness.
Yes, very important. Restlessness and agitation are common, especially in neurotic disorders like anxiety. Sitting still might just increase the anxiety.
So what are the alternatives?
Dr. Phang suggests things like walking meditation or bringing mindful awareness to simple daily activities, washing dishes, walking, eating. Even chanting hymns or basic relaxation exercises can be more suitable than forcing seated meditation.
Finding what works for you. Guideline 8 is interesting. Consider open-eye meditation.
Yeah, it might seem counterintuitive, but he explains why. For someone with anxiety or neurosis, closing the eyes can sometimes ramp up fear or mind wandering. And for someone prone to psychosis, the dark screen behind closed eyelids can sometimes become a space for visual hallucinations or trigger delusions.
So keeping the eyes gently open, maybe with a soft gaze, can feel safer.
Exactly. It can be grounding and potentially more effective for some individuals.
Okay. Guideline 9 goes into specific types. Explore specific meditation types.
Right. He particularly highlights loving kindness meditation, or metta.
How does that help?
It involves actively cultivating feelings of warmth, kindness, and goodwill towards yourself and others. This can directly counteract feelings of isolation, irritability, guilt, or low self-worth often seen in depression and anxiety. It might even help with sleep.
Sounds very positive.
It is, and generally very safe and accessible. He also mentions appreciative joy, mudita, feeling happy for others, and gratitude, katanuda, as good antidotes for depressive states.
And equanimity.
Yes, upekkha, or equanimity meditation. That helps build inner balance, confidence, and resilience in facing fears or difficulties.
Lots of options there. And the final one, Guideline 10. Cultivate right view. Samadhi. What does that mean in this context?
Basically, it means understanding meditation correctly and not using it as an escape.
Ah, like trying to meditate away your problems instead of facing them.
Precisely. Right view here is about seeing things clearly. Understanding the purpose of meditation is to gain insight and acceptance, develop understanding, and foster positive mental states, not to avoid life's challenges or necessary actions.
So it's not a bypass.
No, not at all. It's a tool for working with your mind and experiences, not running away from them.
So if you had to summarize Dr. Phang's overall take on meditation for someone with mental illness.
Well, he puts it beautifully. It's about composing the mind, developing understanding of the psychospiritual factors involved in your condition, and actively cultivating positive mental states. It's about supporting overall well-being.
That's a great summary. And he mentioned a local resource, too.
Yes, the Kuala Lumpur Buddhist Mental Health Association, or BMHA, a good place to look for more information and support from that specific perspective here in Malaysia.
Excellent. So wrapping up this deep dive, the big takeaway seems to be, yes, meditation can be beneficial for people with mental illness.
Definitely. It can be a valuable tool, but it needs to be approached carefully, mindfully, and with the right support.
It's not a magic bullet, or a replacement for professional care for diagnosed conditions.
Absolutely not. It has to be integrated. Guidance from both mental health pros and qualified, knowledgeable meditation teachers is crucial.
Finding that safe, supportive practice that fits you.
Exactly. Tailored to your needs.
Right. So here's a final thought for you listening. Regardless of where you are with your mental health, how might weaving small moments of mindful awareness into your daily life subtly change your perspective? How might it foster a bit more self-awareness? Maybe reflect on which of those guidelines we discussed resonated most with you and why. Thanks for joining us for this exploration.